Now let us invite the very famous Mr. Kunal Kapoor, who is the co-founder of Ketto and the very famous Indian actor. Welcome. For the super insightful and entertaining round of Fireside Chat, I invite Dr. Naveen Nishchal, Chairman, Voice of Healthcare and co-founder, Meadow Health. I hand it over to you, sir.
Yeah.
Hello. Okay.
How are you doing today?
Good. I'm good. Thank you so much. And thank you so much for having me here. This is a wonderful initiative and wonderful conference, and I'm very happy to be part of it.
So, ladies and gentlemen, I'm delighted to welcome Kunal Kapoor for today's event. Thank you very much, Kunal, for joining us on VOH 6th International Conference.
Thank you so much.
Thank you. All of you know that Kunal Kapoor is a very good actor, right? But a few of you know that he's a very successful entrepreneur too. Yes. So Kunal created a company called Ketto. It's the largest online crowdfunding platform in India. Is it true?
That is true. Yes, that's
Great.
true.
Thank you. So before I start bombarding my questions to you, I'll give a little brief of myself first. I'm a doctor by training. I did my MBBS from North Bengal Medical College, Siliguri, West Bengal. Did my MD medicine from Patiala, Government Medical College, Patiala. Worked for Government of Delhi for 4 years. Then I started, then I was bitten by bug of entrepreneurship. I started super specialty chain of hospitals in tier 2, tier 3 towns of India. And I raised funding from Sequoia, Fidelity, now 8 Roads. And I exited when Amar Ujala Group, it's a media group, when they took over. And after that, because I wanted to create a larger impact, I jumped into health tech and I started Meadow. Meadow is basically outpatient care network. So now we are the largest outpatient care network in India, and I'm also part of Voice of Healthcare.
Wow,
Thank you.
That's amazing.
Yeah. So I still remember, Kunal, your performance in Rang De Basanti. So whenever I watch that movie, I get goosebumps. Really. Amazing performance. I still remember your character of Aslam. That was, superb.
Thank you so much.
And another movie, because he's a Bollywood actor, and we always talk about Bollywood. I mean, we can't think of something else. So Love Shove, the Chicken Khurana, and that is also really amazing movie.
Thank you so much. That was a film that was very close to my heart because I was also involved in the writing of the film. So
today we will talk more about your entrepreneurship journey, right? So a lot of celebrities, they chose a business or path, which is, somebody's, buying a cricket team, somebody's, opening a hotel or restaurant. But you chose something different. I think this is sort of an exception. You chose sort of a noble cause. Ketto is helping a lot of people, and so there is one more thing I want to tell here, that I will ask 2 questions from audience as well, because I'm representing them, right? So I will ask my organizing team to take 2 questions from our audience, and you guys are free to ask 2 questions. So first come first thing. And I would also like to congratulate for your newborn baby boy. Okay, so that is a great news. So Kunal, when you were a kid, say 10 years old, 12 years old, did you decide at that time that I want to become an actor or an entrepreneur? So,
well, at that point, I just wanted to run around in the garden. I had not decided anything that early. But I think I was always interested in storytelling. And, I often say this, people think that movies and being a creative person is all about storytelling, but I think being an entrepreneur is also very creative and it's about storytelling as well. Because I think as an entrepreneur, you're trying to disrupt something. And to disrupt something, you have to be able to tell your story very effectively. Whether that's a story that you want to tell your consumers, people that are interacting with you, or it's a story you want to tell the investors, you would know. You have to have a good story to tell the investors as well. So I think storytelling and being creative is obviously a huge part of being a actor and being in the movies, but it's also a huge part of being an entrepreneur. And I think that was something that I always wanted to do. I always enjoyed. I was a very sort of introverted child, but every time I had a chance to tell a story, I sort of came alive and I wanted to tell everyone the story, right? So I think at the core of it, I've always been a storyteller.
Fantastic, fantastic. So I'm curious about to know, about your venture, Ketto. So how did you get the idea of starting off with this venture?
So I was working very closely with a number of NGOs in the social space, and I found that there were challenges that these NGOs were facing. And I always felt like if we could use technology to bring something that was inherently offline, which is fundraising, online, and use the power of technology, I felt like it could be very effective. Secondly, I also always wanted to start a business, but a business that was about social impact. And I wanted to obviously create something that was profitable, but at the same time that had a huge impact on society. And those two things sort of came together, to build Ketto. Because working with these NGOs made me realize that there were a number of challenges that these NGOs were facing. Firstly, the cost of fundraising was very high. Sometimes it was as high as 50-60%, and only 40% went to the people that actually needed it. Secondly, I found that the challenge that NGOs faced is that once you reached out to people, you couldn't reach out to them again. Once someone's already donated, you can reach out to them once, twice, but it becomes very difficult for them to keep donating to you. And thirdly, there was a challenge of reaching out to new donors because, when you're working offline, you have to hire an agency and that agency goes and finds new donors for you. So there's a big challenge involved in that. But I felt like if we could bring all this online and connect, sort of build a bridge between people that can help and people that need helping using technology, then that's something that would be very powerful, which is why Ketto is actually an abbreviation for Key to Tomorrow. We believe that if we could sort of create this platform which would democratize fundraising, then that would be the key to tomorrow.
Fantastic, fantastic. So, a lot of people, they want to donate money, but in their head, there is always a hitch that whether whatever I'm donating, it will go to the person. Even, a lot of government schemes where, money doesn't reaches to the person who is in need. So how are you, tackling this challenge of transparency at Ketto? I know, I heard that you guys are, working on this and you are taking care of this challenge. So what all steps you guys are taking on this?
So I think there would be two things that are very important to us. One is that at Ketto, most of the fundraisers are medical fundraisers, right? Most of the people donating are donating for medical fundraisers. And we've now tied up with over 200 hospitals, out of which 170 hospitals we have representatives and people of our team that are in the hospital. So what that does is that it not only helps people start a fundraiser very quickly. So if somebody's in need and needs to start a fundraiser, they can reach out to our team immediately. The other thing that it does is that it gives a chance for our team to go and verify the campaign, right? Because then you're in the hospital, you can check the paperwork, you can check the documentation, you can speak to people in the hospital to know for sure that this patient is raising the money for the right reasons. And you also get a chance, obviously, because you're interacting with the patient and the person that's raising for the patient to get their documentation. So I think that takes care of the transparency in a big way. The other thing that we do is that on our platform itself, we have an update section, and we encourage everybody that is raising on the platform to constantly put up updates. And those updates then get emailed to people that have donated and WhatsApp to people that have donated, right? And we encourage them to do this even after the campaign is over, so that people know where the money is gone, how that patient is doing. Has the patient recovered or not? Does the patient need more money in the future? So these two mechanisms are being used to make sure that one, that the fundraiser is legit, and the second is that there's enough updates being provided to people that contribute.
Brilliant. So yeah, I mean, I agree with your point that most of your fundraise is for, hospital. We are a country of 1.3 billion people. I was just talking before you came. So, and, affordability is one of the biggest challenges in healthcare. And although government has come up with Ayushman Bharat scheme, where a family is covered, a family of 4 to 5 people is covered with 5 lakhs per year, but that is not enough. If somebody is, suffering from a malignancy or some other rare diseases, in that case you need more money. And I know that a lot of, I'm not talking about, people below poverty line, even people, middle class or upper middle class, they can't even afford that kind of, money. So I'm happy that platform like Ketto, it's helping all those guys, and you are, working with hospitals also. That's also good to know. So I also heard that you guys did phenomenal work during COVID. So I want to learn something. I mean, if you have some anecdote or some story, would love to hear. I mean, how did you guys, work in COVID, and how did you guys, help people during COVID time?
Well, firstly, I think what was amazing during that I saw during the pandemic was that how quickly everybody on our team, and I'm sure other teams, adapted to work from home. We felt like it's going to be very challenging. People will find it very difficult to sort of adapt to a digital life. But within a couple of weeks, everybody was on the job and doing exactly what needed to be done. And also during COVID, of course, there were many fundraisers. I mean, the quantum of fundraisers increased by a lot because what I found, which I found really amazing, is that everybody that I knew around me wanted to make a difference, right? And wanted to contribute and wanted to, affect somebody's life. And friends of mine that have never done any sort of donation or contribution were calling me and saying, how can I help? Can I start a fundraiser? There's a friend of mine who's never donated, but he started a fundraiser for animals. And he reached out to all his friends, raised 14 lakhs. And for a month, he fed all the animals on the streets, right? So those were the kind of stories that we were coming across, where people were constantly coming together and saying that I want to make a difference. And I don't remember what the exact end figure was, but we raised over I think, $35 million during the pandemic. And what for me was very, very important when we were starting Ketto also was that I wanted this to be a place where a lot of young people come and make a difference, because I found that there's a lot of young people in the country that want to make a difference, but they feel like the social space is not for them. They feel like, it's got too much gravity and there's too many serious people, and maybe this is not what I want to do. But when we started the platform, we were like, how do we engage young people? And during the pandemic, I got a call from a friend of mine, and he has a daughter who's 10 years old. And he said that I was watching the news with Sia. And Sia said, I don't want to just watch the news, I want to make a difference. She was watching the migrant crisis, and she said, Dad, how can we help the migrants, right? And so he called me and he said, can Sia start a campaign on your platform? I said, yeah, sure. She raised 12 lakh rupees for migrants that were, that didn't have food or were underprivileged and stuff. So somebody as young as that was watching television and said that, look, I want to make a difference. I don't want to just sit and consume news or consume information. How do I make a change, right? And I think that's what the power of a platform like this is that we do nothing but provide avenue for people to make a difference, right? If this had happened, say, 10 years back, she would have wanted to make a difference, but there would have been no avenue for her. I think what we are doing is just providing avenue for people to make an impact and do good.
Wonderful. I think technology has changed the entire landscape. So, a lot of people say that I will only donate or I will do only charity when I will have huge money. In my opinion, you don't need huge money to, do charity or help people. A very small act of kindness. I mean, I know a lot of people around us, support staff, somebody's driver, somebody's maid. If we can, help them, if we can, get their children better education, I mean, that small act of kindness is also, it's a huge thing for them at least.
Yeah, and also like on the platform, crowdfunding, the power of crowdfunding is that, earlier you'd have to reach out to one person and say, give me 1 lakh, or two people and say 50,000. Here you can reach out to, 1,000 people and say, can you give me 50 rupees each, right? And I've seen so many campaigns where people that have started the campaign keep looking at, how much money is raised, and every 100 rupee makes them feel good. So people feel like, nahi, main 100 rupees dekh ke kya farak padega. But the person that's actually receiving the money, every 50 rupees, 100 rupees, 200 rupees makes a big difference to them.
Yeah, every penny counts actually.
Correct, absolutely.
So, Kunal, I got to know that you guys are working in healthcare, and somebody helped for, migration worker also. What other, sectors, in what other sectors you guys are raising fund for?
Well, mostly health, mostly medical fundraisers. That's the one that obviously uh, people are also most likely to donate to. And secondly, like you said, the need for that is the most, right? So there is wonderful government schemes. There are lots of NGOs. There's people providing grants. But still, we live in a country where the whole health sector is very underserved, right? So I think the medical fundraisers are the most, we see the most traction and most amount of campaigns that are started for medical fundraisers. And for us, actually, that is a really sort of important thing, because what we found is that what happens is that when you fall sick, the first thing that you do is obviously you reach out to your insurance, you dip into the insurance. But very few people are insured in this country, right?
Absolutely.
Your next step will probably be using your savings. Then the third step will be, if that doesn't work and that's not enough, then you start taking a loan from people, which often you can't repay. And if the loan is not enough, then you start selling property and jewelry and stuff, right? What we wanted to position Ketto as is that once your insurance runs out, you can turn to people, and you can turn to people to help you out instead of dipping into your savings, selling land, jewelry, taking loans from people. Is it possible for us to be the ones that you reach out to after your insurance is run out, right? So that's where we are trying to sort of position ourselves so that people don't have to resort to very desperate means to take care of their medical needs.
Wonderful, wonderful. So you are here as an entrepreneur, and entrepreneurship is a tough journey. I always tell people that it's a hurdle race. You cross one hurdle, and next hurdle is ready for you. So what are the challenges you see in future, and what are your plans to address them?
Well, it's like you said, it's constantly challenging. There's never a dull moment, and that's not necessarily a good thing. Uh, there's always something or the other that you're firefighting or trying to take care of. But I think for us, the biggest challenge was obviously when we were starting off. There was nobody that had heard of crowdfunding in this country, and we were one of the first few players, and nobody understood what it was about, right? So it was about going to each and every NGO, hospital, and trying to sort of educate them about crowdfunding. So that was obviously challenging, which is creating awareness. The second thing was that obviously no investor wants to back you, because the way investors work is that there's always one field which is doing really well and everyone wants to put their money.
FOMO works.
Correct, correct. So they all want to put their money into that, but nobody wants to sort of take a chance with new kind of technology, right?
Absolutely.
So that was very challenging as well, to convince investors to come on board and back an idea like this. Uh, so I think the challenge that we had in the early days, which is awareness, has now been solved in a certain way, because I think people in urban centers know about crowdfunding and turn to crowdfunding when they need it. I mean, we've had so many cases of people that have contributed to a fundraiser, and then when they need it, they've started a campaign of their own, right? So a lot of awareness has been created in the urban centers, but I think the challenge is to reach out to tier 2, tier 3 cities, because that's where the need is even more, right? And what we've started doing now is that we've started partnerships in tier 2 and tier 3 cities with hospitals, to educate hospitals about what the possibilities are, NGOs. start campaigns there so that people understand that this is something that you can turn to. But I think for us, that I think is the biggest challenge is to reach out to the smaller centers, the tier 2, tier 3 cities. And I think we will feel successful only when we manage to do that. Because I think we've just only scratched the surface with the urban centers. And there's a large part of India that still needs help. And we want to reach out to them.
Absolutely, absolutely true. Because, only 7% of Indian population lives in, metro cities, 25% in tier 2, tier 3, and still, 69% of the people live in rural India, and they don't have any access to healthcare. We don't have enough doctors, enough, manpower, infrastructure. So I'm sure if you, you are targeting tier 2, tier 3 cities, then you can, target rural India as well. Okay, so what do you think about yourself? You are more of an actor or an entrepreneur? Which role you like the most?
I was somebody, my Twitter bio says tall. And somebody was asking me, why does it say only tall? So I said, because that's the only thing that is going to be consistent through my life now. I might lose weight, I might gain weight. I might be an entrepreneur, I might become an actor, maybe a singer sometimes. I might be a son, I might be a father. All the roles will keep changing, but I'll always be tall.
Yeah.
Unless the world dramatically changes and we have lots of very, very tall.
Not in your lifetime, at least.
The next generation is much, much taller.
Yeah.
So that's the only thing that's consistent.
Absolutely.
And I think it's very difficult to sort of define, who I am and what I do. I think the one thing that I think is at the core of me is curiosity.
Yeah.
And I think curiosity sort of draws me into different directions. Sometimes it's storytelling, sometimes it's being an actor, sometimes it's being an entrepreneur. And I think that's something that I really enjoy because I feel like life is really short.
Yeah.
We have very little time, and I want to explore as many things as I can.
So you are wearing multiple hats. Yeah.
I'm trying to. I mean, my first film was with M.F. Hussain. It was a film called Meenakshi.
Okay.
And he said something really beautiful. He said that, don't let people define you.
Oh.
They want to tell me that I'm a painter or an artist, right?
Okay.
But I'm not just a painter and artist. I can also be a musician. I can also be somebody who really enjoys food and enjoys cooking food. I do so many different things, but people will always try to define you by one thing because it makes their life easy.
Yeah.
He's a doctor, he's an actor, he's a painter, he's an artist. But you're so many things, and don't let people restrict you from that. And I think that's something that's always stayed with me.
Wonderful, wonderful. So what's coming up next, either on OTT or
So
big screen?
I'm writing right now.
Oh.
I've started something called the Writers Room, where I've hired 4 writers to write the sort of content that I want to do. There's a lot of times we complain about not getting the sort of scripts that you have your heart in.
Yeah.
And so one thing is to sit back and wait for to get the scripts that you enjoy. The other thing is to create them. So I'm now creating the content that I want to act in.
Great.
So that's one of the things that I'm doing. I've just turned producer.
Oh,
I'm producing a film. Thank you. On this athlete called 𝐂𝐨𝐺𝐵,
okay.
who's the only Indian Olympian to go to the Winter Olympics 6 times. So I'm producing a film with him. I'm acting in 2 OTT shows.
Yeah, I know The Empire.
Yeah, that was done now. There's 2 more that are coming up that I start shooting in June and August. So yeah, lots of stuff happening.
So would you like to give some message to today's youth? I mean, today's youth is restless, distracted.
Yeah, in fact, I would just, I've been trying to build a company in what is the new economy, which is called Web3. And what I found, and which I tell a lot of people that are young and are building in the Web3 space, is that reduce the amount of things that you pay attention to. Because like you're saying, we live in a world which is very distracted. And I find a lot of young people want to do 4 or 5 things at the same time, right? They're not working on one company, but they're working on, they'll do a small job here, make $200 there, code for somebody, write something else for someone else. And I always say reduce your attention, because focus on one thing, make that happen, make that big, and then explore other things, obviously. But don't go and do 5 jobs at the same time, because then that becomes difficult. So it is we live in a world where by default we have access to so much information. I think you've got to be very sort of aware of the information that you're consuming and if that information is in line with what your goals are or not. So define your goals and then, seek information that is in line with those goals.
Great. So can we have 2 questions from audience? Sir.
Dr. Professor Rajesh Shah
Hello.
from Ahmedabad, working as a medical superintendent of one of the government general hospital. I would like to have some guidance from you. Suppose some hospital is willing to join for your this crowd fundraising program or some specific issues, how they can join. And second thing, if someone is willing to volunteer to your this work and organization, how one can join.
Sure. So we can actually get our team to get in touch with you. We are always looking to work with new hospitals. We're always looking for new volunteers. So in fact, I can get somebody from our team to Mamta's here, and Mamta will connect with you and she'll get in touch with you, and someone from our team will call you. And we can figure out how we can, start a partnership so that we can, raise funds for whatever's happening in the hospital. And at the same time, maybe we can also have somebody from the team being there so that doctors are educated and know and understand how this is done. If there's a patient that has an urgent need, you have somebody from the team that can reach out to that patient. So I'll definitely get somebody to get in touch with you and, help you set this up. Thank you. Thank you so much.
1 question more.
Hello, sir. I'm Dr. Umang. I'm from Tata Institute of Social Sciences. So I have a question, like you are working on fundraising and this, which is really great. But there are a lot of people, those who don't have this understanding of documents which they need to provide when they are seeking government schemes. And I hope that, I think that problem is there with crowdfunding mechanisms as well. That is what I have seen in my field experiences. So how your organization is tackling with that, like how you people are educating people on what exactly is needed and how they can come to you with all that sort of appropriate documents.
When we started off, we realized that we were running a lot of campaigns, but these campaigns were successful only if the patient themselves had a network of people that they could reach out to, right? So supposing I'm sick, I have a lot of friends that can afford to contribute, and my campaign will be successful because I have a network that can contribute, or my network can reach out to another network. But there were a lot of people that were daily wage workers that obviously don't even have a network that they can reach out to. So they could start a campaign, but then who do they reach out to say, I need 5 lakhs or 10 lakhs or 20 lakh rupees for a surgery? So what we started is a sort of partnership program at Ketto, where what we do is that if somebody doesn't have a network, we tie up with them, we partner with them, and we run advertisements for them, right? And these advertisements then reach out to people and stuff who can contribute to someone that doesn't have a network of their own. So that was one step that we took in the direction so that more underprivileged people can have successful campaigns on the platform. The other thing, like I said, is that we have representatives that are in hospitals, and these representatives work with every patient that comes into that hospital that needs to start a fundraiser. So the representative will go and make sure that all the documentation is done, make sure that all the things are in place. They know what they're getting into. They know the sort of steps that will be required. So we have somebody that can actually educate patients on what needs to be done and what sort of documentation needs to be available to start a fundraiser.
Thank you.
I hope that answers your question.
Yes,
Thank you. Thank you, Kunal. So we have sort of extended this session a bit. We are running out of time. I wish we could talk more. Guys, let's spread good word about Ketto. Kunal is really, doing incredible works. I mean, he's creating impact in the society. Thank you very much, Kunal. It was a wonderful conversation. I look forward to more such conversations in future too. Thank you very much.